Hello, my name is Kimberly Jones, and one thing that I would like to change in the healthcare system would be prescription drugs. A lot of times doctors will automatically say, oh, well, your cholesterol is high, you need a prescription for this, and oh, you need a prescription for that. So I know we see a lot of times in the hospital on a med-surg tele floor, just on the floor, that when you go to pass med, you're passing 20 prescription drugs. One for diabetes, one for blood pressure, another one to counteract this, so this other medication that you're taking. So there's just a lot of times that patients come in, they don't even know what they're taking. You ask them for their med list and they're like, oh, I don't know, call the pharmacy. Or, oh, my wife has that list, she takes care of it. Or, oh, that's that little green pill that I take every morning. So, I mean, a lot of times doctors will automatically jump to prescriptions first before considering alternatives. I'm not saying that we should do away with prescription drugs at all. I just think that there is a better alternative that we should try first. I mean, you break your leg, that needs to be fixed. Understandable. But if you have a patient who has high cholesterol or their blood pressure is high, what's the alternatives? Change in diet, exercise, and it should be more than just telling them, oh, you need to go on a diet. I think that there should be alternative programs and assistance and education to patients who can better understand this. So if you're asking them, to change something or to try an alternative, you should be able to educate the patient and give them the resources that they need. So if you just say that, a patient's been needing to change, they have cholesterol, high blood pressure, and you told them and you gave them the alternative to do diet and exercise and give them the resources and told them to check back in 6 months and to monitor while they're doing this, they come in, it's not working for them, then okay, medication can be as a second alternative to help with things that are already in place, along with pain medication. So there are alternatives to pain medication that we don't really always go to. I know in previous classes they used alternative prescription drugs for pain medication. One was music therapy. That would be awesome. That if you have patients in the hospital, and sometimes I know pain is it can be judged. Let's see, what am I saying? That a lot of times, a patient's pain rating is subjective, and that you can't really say, well, you're not 10 out of 10. Oh, your hair's not on fire. A person's pain is a person's pain, and they judge it how they judge it. But when you're willing to throw morphine or Dilaudid or right on top of it, that's what they think. That's the only thing that can help them. So just trying to, and we build up a pain tolerance. So, you automatically go straight for pain medication. They're not going to get relief unless they have pain medication. So it is a part of mental as well as being physical. So, just trying alternatives. Massage therapy is another alternative that you could try. And, if it doesn't work, it doesn't work. You can always use prescription, but we shouldn't always go to prescriptions as the first alternative. So, as a BSN nurse, the change in roles and quality, patient outcomes, and reimbursement, I think there would be, I work in a hospital where we have a lot of homeless or patients that don't have insurance. So therefore, we're not getting reimbursement, period. So sometimes it may be part of weaning that out, knowing that they're not going to be able to come in and get certain medications when they're in the hospital may perturb them a little bit, or patients who constantly are having alcohol withdrawal. that maybe there should be an alternative, then I know we use lorazepam to help them come down from their, so they don't have withdrawals and seizures and things like that, which I understand. But when we continuously feed that habit, it's nothing's changing. We're just feeding the habit, and that needs to stop. So patient outcomes, patient would probably have a better outcome because their lifestyle would change. They would be choosing healthier alternatives, and when you start making good choices and have better quality of life, and you can ultimately your overall is good, your mentality is good. I know, for example, a lot of depression medications, there are natural foods in our environment. Blueberries have antioxidants that help with depression. Some patients may not know things like that, so it would help to educate them to just use as alternatives. If it's not helping, it's not helping. So I think we should be able to, in the hospital, implement our nurses to be able to care for our patients with alternatives rather than just prescriptions. Because if you've ever worked on a floor, you spend 90% of your day passing medications. So you would see nurses not being able to do their job more effectively, taking care of the patient, doing other things instead of passing meds 24/7. This would also incorporate new jobs within the healthcare system in the hospitals that have insurance cover things for alternatives. And like when they're in the hospital, make sure every patient has a nutritional visit so that they are aware that it is built more structural towards their diagnosis or diseases, that maybe they can find alternatives to food or other alternatives to exercise or therapy that would help them better than just throwing a pill down their throat. What types of restructuring activities? So they, that would also implement new jobs. So that would help, and it would also hopefully perturb the patients who keep getting readmitted over and over and over again because of they know that they're going to get medication, whether it be pain medication or just any type of medication. So I think if we just do a better job of fixing the habits of why they need the prescription and giving them the resources and the alternatives, I think that would be better. Also, it would also help in the long run with ODs. And, some patients come in because they won't pay medication and they're going to get high, and then they go out and then they OD. So this is just an alternative I would like to see, is less prescription drugs and advertising on television, because a lot of times patients see it and like, oh, I have that, I need to go in for it, which is not also true. If we should be promoting healthier lifestyles and alternatives opposed to prescription drugs. Thank you.